In the previous video, we briefly looked at how drugs like NSAIDs can lead to a patient finally presenting with a peptic ulcer disease. And in the same video, I talked about how with chronic use of these same drugs, the same would be true. It can lead to a patient having renal dysfunction, or in this case, a patient can present with an acute kidney injury. Some of these drugs are drugs like aspirin, drugs like diclofenac, and ibuprofen. Mainly, these are being used for pain management, and as a side effect, like we had seen in the previous video, it led to a patient presenting with a peptic ulcer disease. In this case, we want to see how the chronic use of NSAIDs can lead to a patient having an acute kidney injury. So when we're looking at these drugs, we are mainly taking them for pain, amongst other things that they can also be responsible for. And when we're dealing with pain, the brief pathophysiology is we are starting with arachidonic acid leading to the production of prostaglandins. This is mediated by an enzyme known as cyclooxygenase, or COX, either COX-1 or COX-2. The prostaglandins that will then be formed will then lead to the body responding through things like pain and so forth and so on. Now, NSAIDs are working at this step. They are inhibiting cyclooxygenase. With the inhibition of COX, it means that these prostaglandins won't be formed, and if these prostaglandins aren't being formed, some of the body's physiological responses, like in this case pain, also won't be noticed. So NSAIDs are working at this stage. Now, coming to the prostaglandins, there are different types of prostaglandins that are being formed. At the level of the kidney, we are mainly interested in PGE2 and PGI2. All in all, these prostaglandins that are being formed are responsible for vasodilation, basically how wide the lumen of a blood vessel is. And like we've said already, we are saying that the chronic use of NSAIDs is leading to the blockage of these prostaglandins, and if these prostaglandins are being blocked at the level of the kidney, it means that vasodilation, how wide the lumen is, the vasodilation will be distorted also. So this means if this was the size of the lumen, theoretically speaking, we end up having it a little bit narrower. It becomes constricted. So this was the previous or the before, and this becomes the after. Now, I have to mention this. NSAIDs leading to AKI will not just happen just there and then. It's going to depend on several factors, but some things to look out for will be things like if the patient is in a dehydrated state, if the patient has got heart failure, liver cirrhosis, the duration of these drugs, how long the drugs are being taken, the dosages, and if the patient is also taking other medications that are acting on the kidney, such as ACE inhibitors, ARBs, and even diuretics. All in all, these just increase the likelihood of this happening, but it's still the same physiological pathophysiology happening. We have NSAIDs that are preventing the production of prostaglandins, and these prostaglandins are responsible for vasodilation at the level of the kidney. And with this happening, it means that we've got narrower blood vessels within the kidney. And like all organs, the kidney is going to need some blood supply or blood flow for things like what? Gaseous exchange, for nutrients. And in this case, what we're doing is we are reducing the blood supply, we're reducing the blood flow to the kidney, and ultimately this leads to injury, or it leads to an acute kidney injury. If you want to be a little bit more specific, it's leading to a prerenal AKI. Alright, thank you for watching this video. Peace.